Hmm?
Hello dear student, I have discussed in previous class and have started a new topic called drug act on our respiratory system, and in first class of that chapter of respiratory system drug, what are act on respiratory system and what are the primary drugs are there which generally act on airways or respiratory tract in a human body to treat different diseases or disorder related to our respiratory system or inhale exhale system. And in the previous class I have discussed about the first common topic that is almost everyone generally face during cold time, that is fever, cold or cough. So in previous class I have discussed about drug act on cough, and I have already told you that in today's class I am going to discuss about a new topic, that is asthma. It is also related to our respiratory tract. So today's topic is asthma and the drug used to treat asthma. So first of all, we have to just know, or we have to just understand what is asthma or why that asthma occurs and what are the reasons and what are the types of asthma. First, we have to remember that in our body different systems are there. In that, generally respiratory system help us in inhale or exhale air, especially to take oxygen and to release carbon dioxide. But in case of asthma, what it happens due to the bronchodilation, and that bronchodilation, sorry, due to the bronchoconstriction, and that constriction can be due to different factor, mainly for the allergic reaction or hypersensitivity reaction of our bronchial smooth muscle. So what happens when any allergic system like dust or pollen or any pollutant come and enter into our body through our respiratory system, it causes inflammation or obstruction in our airways or in our respiratory tract. So due to the obstructs in respiratory tracts, that patient generally suffers from breathlessness and difficulty in taking breath, or getting very tired after doing a little work also, due to the inflammation or obstruction in their respiratory tract. Now that asthma can be triggered by allergic reaction also, and sometimes it can be due to our daily life balance also, or sometimes it can be due to the weather change also. According to that, asthma can be classified by two types of asthma. One is intrinsic and another one is extrinsic. In common, that is extrinsic. In extrinsic, what it is happen, in this case asthma generally takes place due to the allergic reaction. How that allergic reaction works: when a foreign body like pollen, grains, then dust, or sometimes some people have allergic on food, etc. That time, when that foreign antigen is entering into our body, especially in respiratory tract, during the respiration or taking the inhaled air from outside, that foreign body generally comes into our body, and our body started to show hypersensitivity reaction, and for that airway started to constrict sometime due to the over excitation or hypertension in respiratory tract, that can lead to an allergic reaction in bronchial system and causes difficulty in breathing. This is called extrinsic asthma. But in case of intrinsic asthma, this is triggered by the Non-allergic factors. What are the non-allergic factors? Sometimes due to the over exercise, you can face asthma or breathlessness. Sometimes due to the cold or due to the weather change, also that can take place. So due to the different reason of that asthma, they are classified into two parts: extrinsic asthma and intrinsic asthma. Extrinsic asthma is triggered by different allergic factors like food, dust, then pollen grains and other foreign particles that generally enters in our body through inhalation in respiratory tract. And in case of intrinsic asthma, it is generally triggered by different non-allergic reasons like excess amount of exercise, cold weather, then that also can lead to the breathlessness or asthma, that is called intrinsic asthma. So that was a simple introduction about asthma. What is asthma, what are the reason, and according to the reason how that asthma is classified into two parts. One is intrinsic asthma and another one is extrinsic asthma. Now we are going to the main topic, that is the today's topic, that is anti-asthma or anti-asthmatic drug. So what are these drugs? These are the classify of drug or classes of drugs that are generally used in our body to treat asthma, but not for all. Who are the patient who are suffering from asthma, to treat all those drugs are used. So the class of drugs that generally used to treat asthma, that are called anti-asthmatic drugs. So now we are going to discuss about the different classification of anti-asthmatic drugs. First of all, you have to remember that classification is generally based on their mechanism of action. That means how that drug is going to act on our respiratory tract and other system of our body, and going to fight against that asthma and going to treat asthma. According to that, anti-asthmatic drugs are classified into the different classes. The mostly used in our daily life, especially for asthma pupil, the drugs or that class of drugs that generally act or used most, that is bronchodilators. In bronchodilators also, all those drugs are classified into three parts according to their specific mechanism of action. That bronchodilators can show its action in three types: by blocking blocking cholinergic receptor, or by stimulating beta 2 receptor, or by stimulating methylxanthine. So according to the specific mechanism of action, bronchodilators are also classified into three subclasses. First of one is beta 2 sympathomimetic. Before only you have studied about sympathomimetic, that are there. I have discussed about two types of drug, beta 1 and beta 2. In case of treatment in asthma, generally beta 2 sympathomimetic drugs are mostly used as a anti-asthmatic drug. What are the example of beta 2 sympathomimetic drug? Salbutamol and terbutaline, but salbutamol is mostly used. Second type of classification according to their mechanism of action, that is methylxanthine. What are the example? The example is theophylline. And third subclass of bronchodilators as anti-asthmatic drug is anticholinergic drugs. Anticholinergic drugs, that also I have discussed in previous classes. In this case, anticholinergic, especially M3 receptors blockers, are generally used as anti-asthmatic drug to treat or overcome asthma. What is the example of that? Ipratropium bromide, tiotropium bromide, etc. So what are the subclass? Beta 2 sympathomimetic, example is salbutamol, terbutaline. Then the second type is methylxanthine, example is theophylline, and third one is anticholinergic, especially M3 blocker, that is ipratropium bromide. So that was the first class, and their subclass that generally act as bronchodilator to treat asthma as an antiasthmatic drug. The second type or second class of antiasthmatic drug is leukotrienes inhibitors. Leukotrienes inhibitors. In autocoids only, I have discussed you about the different autocoids. There we have studied about cytokines, prostaglandins, interleukins, leukotrienes, etc. In this case, generally as leukotrienes can lead to the bronchoconstriction and can further lead to the asthma. So to treat the asthma, sometimes drugs which are generally act to inhibit the action of leukotrienes or production of leukotriene can also be used as anti-asthmatic drugs. So these are also a classification of drugs that can be generally used as anti-asthmatic drug. What is the example? Montelukast and Gefileucast. Montelukast and Gefileucast. The third classification of anti-asthmatic drug is mast cell stabilizer. Mast cell stabilizer. What is the example of mast cell stabilizer? The example of mast cell stabilizer is sodium chrome glycate. Chrome glycate. So what is the sub classification of antiasthmatic drug? That is mast cell stabilizer. Example is sodium chrome glycate. That was the third classification. Now the fourth classification of anti-asthmatic drug is anti-AGE drugs that generally act against the AGE production in our body to inhibit the hypersensitivity reaction of immunity to treat asthma. What is the example? Omidgetab. The fourth one or fifth one that also can be used as an anti-asthmatic drug, that is glucocorticoids. Glucocorticoids. That glucocorticoid drug can be in two types. It can be taken by systematic, means parenteral or oral. So these are called as systemic drugs. What is the example of systemic glucocorticoid drug? That is hydrocortisone, then prednisolone. That are the systemic drugs or systemic glucocorticoids that can be taken orally or by a parenteral way to take as anti-asthmatic drug to treat asthma. And sometimes these type of drugs also can be taken as inhalation form. The example of inhaled glucocorticoid is beclomethasone. That beclomethasone is generally used in different type of inhaler including salbutamol. So that beclomethasone also is used as inhaled glucocorticoid drugs. So that was all the classification of antiasthmatic drug, where we have studied about bronchodilators and their subclass with example. Then the second type leukotrienes inhibitors. Then third one mast cell stabilizer. Fourth one anti-AGE drugs and example. And at last we have discussed about glucocorticoid anti-asthmatic drug with the example of systemic glucocorticoid and inhalation glucocorticoid. So that was the classification of asthmatic drug.